The data on the Republican health care bill is compelling. 22 million people losing insurance. But it's often stories that drive the decisions that members of Congress make, that members of the Senate make. And so I'm asking you to do something over the next few days to share your stories with us. They might be really personal. They might be hard to tell. But I want to make sure that I can tell the real stories of people in Connecticut and how this bill would affect you. If you're on Medicaid, if you have a pre-existing condition, if you've gotten your health care through the Affordable Care Act, like hundreds of thousands of people in Connecticut, let us know what the impact, the personal impact of the Republican health care could be on you. I want to tell you one story that has always affected me. It's a story that dates before the Affordable Care Act. It's a family in Meriden, the Berger family. They were doing everything right. They were working. They were taking great care of their kids, saving for college. And the husband switched jobs, and during the week or two that he was waiting to start his new job, their son got diagnosed with cancer. And you know what happened after that. The new insurance plan, well, it wouldn't cover the son because he had a pre-existing condition, something that would not be allowed legally under the Affordable Care Act. And then you also probably know what happens next. The Bergers, well, they lost everything. They went through their savings. They went through their son's college account. They had to declare bankruptcy. They lost their house. They lost everything just because they had a son who got diagnosed with cancer during the wrong week. Personal bankruptcies in this country have been cut in half since we passed the Affordable Care Act. Why? Because virtually no one goes bankrupt, loses their entire savings because of a medical diagnosis. That doesn't happen with the Affordable Care Act any longer. We can't go back to those times when people like the Bergers had their lives altered just because of bad luck. That story has always motivated me, and your story that you share with us on our social media platform, whether it be on Twitter, on Facebook, through Snapchat, I'll share those stories with my colleagues. You can make it anonymous if you want. You can withhold some information if you want. But it's stories in the end that may stop this dangerous Republican health care bill from becoming law. I hope you'll share yours with us.